Hi, I'm Danubia Hester. I'm one of the medical oncologists and hematologists here. I'm a physician, part of the Maryland Oncology and Hematology group, and I'm here to give you a little bit more education about breast cancer. So the reason I am compelled to give you this information is we know African American women under 40 have the highest incidence of breast cancer in the United States. And what that compels me to do is to always recommend a great relationship with your physician team. That physician team can consist of nurse practitioners, PAs, which are physician's assistants, and primary care doctors. Those are usually your primary team when expressing your issues. In addition to them, you have your OB-GYNs as well. And I think it's very important to have a good working relationship with them and trust in them, primarily because those are the physicians that are going to take you to get your screening. And when I say screening, the American Cancer Society recommends that women under the age of 40 not get breast cancer screening, but over the age of 40 it's optional, and over 45 they recommend that it gets done. I am biased in my recommendation, but I do recommend women at the age of 40 start the conversation with their primary care doctor, their primary care physician team, to have that discussion about getting a mammogram. The biggest key is screening and making sure we're not missing earlier diagnosis. So there are times under the age of 40 that women should be triaged to screening. Those are women with family histories of breast cancer and other certain malignancies. That's why it's very important to have a working relationship with your primary care team to ensure that you have access to screening, okay? I do want to say any abnormality in the breast, whether it be skin changes, such as darkening of the skin, turning red of the skin, any nipple changes, any new leakage from the nipple area, any pain in the breast area should be assessed by a physician primarily, and in the appropriate setting should be imaged, okay? Imaging techniques can consist of three modalities primarily. One is an ultrasound that's primarily used to understand what's going on in dense breast tissue. We know younger women have denser breast tissue, so an ultrasound is better at understanding any tissue changes such as masses felt in the breast. Then we have mammographies, which use different modalities of putting the breast in different shapes and taking images from that area. And the next one is a breast MRI. Breast MRIs are used in a very specific subset of patients to understand what's going on in the breast. Generally, screening at the age of 40 is a mammography. That can happen with or without an ultrasound. The ultrasound is oftentimes used if a biopsy needs to be performed, or if the breast tissue looks dense and they cannot understand what is going on, if there's some atypia seen. Atypia being abnormality on imaging. In addition to screening, I do recommend doing a breast self-exam in the shower, regularly palpating to understand your normal tissue. So if any changes in tissue does arise, that you can bring that up so that can be assessed.